So as discussed in our presentation, photodynamic therapy can be utilized in various different ways. One of the ways we utilize it is photodynamic therapy IV infusions. So you always need a photosensitizer to make light therapy work. So, for example, in our office, we utilize a system where we can actually program the frequencies for light penetration and to utilize healing. So things like red light, infrared light, blue light therapy, green light therapy, yellow light therapy. These these different wavelengths produce a different type of outcome for the cellular structure itself. So for example, here I've got a fiber optic cable and I've got a machine that I can program the type of laser that I want. So right now I'm going to program a blue light. So our patients will take things like methylene blue, riboflavin, which is B2, or curcumin. Now, each one does something a little bit differently. So those are three that we primarily use, although there are quite a few others that you can utilize. Riboflavin we use as a dye for patients that have biofilm, mold toxicity, Epstein-Barr reactivation, COVID, and many other type of infection-related type of diseases. C. diff is a very common one, and it also kind of helps correlate with patients that have IBS and other type of inflammatory diseases. You can also utilize these type of treatments before you do any type of regenerative therapy, prolozone therapy, PRP therapy, and even stem cell. There's quite a bit of research out there showing that the platelet counts and your recovery rate will increase dramatically when you utilize things like red light therapy and other photodynamic therapy. So for example, I'm going to utilize this and show you what blue light looks like. So here I've got a IV catheter that we will use with our patients. So we'll have an IV drip on one arm, and that is allowing the body to kind of absorb this natural type of dye in the system. And you'll see this fiber optic cable that we have here, and it's got a little sleeve on there so you can actually see the fiber optic. And what I'm going to do is I'm going to go in, I'm just going to program what frequency. Now, the theory on light therapy is that different frequencies and different sweeps can produce different outcomes. So patients that have chronic inflammatory diseases, you can actually program the frequency to that. There are certain diseases that will reflect, such as joint pain, for example, rheumatoid arthritis, patients that have got skin disorders, any type of infections. These all have different frequencies and different sweeps that you can utilize using machineries to kind of target the tissue specifically. You can actually do this in IV form, or we can actually do this around a damaged tissue structure. Let's say we're doing a knee injection. We can actually go in with the fiber optic cable after the injection and increase circulation. This allows for a more robust type of treatment, and your outcomes are a lot better. So it's different than just going in and doing just a simple injection. If you take your time and really kind of utilize this type of technology, not only limits the amount of treatments that you need and helps you reduce costs, but your outcome is now exponentially increased. So I'm going to program just a simple frequency here, and you can also program the amount of intensity that the laser can actually output, and we're just going to kind of maximize it. And I'm going to kind of move this around a little bit. You'll hear it kind of beeping, and I don't know if the camera can see, but you can actually see the laser. So imagine putting this, you can see this now, and imagine we utilize an IV into the system itself. And what this does is, as the blood is circulating and picking up the photosensitizer that you put in, these cells really absorb it, and you can actually see it under a microscope, and it's really cool to kind of visualize and see. And we actually have these microscopes here, and as this catheter is placed, now your blood is getting a direct type of result, being exposed to UV light, red light, infrared light, green light therapy. Now, each one does something different, as explained in the presentation, and that is going to help us in your road for recovery. I'm going to show you some other types of lasers as well. So, for example, I'm just going to simply use red light therapy. Everyone knows what red light therapy is. I'm sure a lot of you guys have that at your house. So if you're doing red light therapy, I recommend maybe taking some curcumin before you sit under the red light, because it really kind of enhances your exposure to that light. So I'm going to set the frequency on this one as well. Go. I'm going to maximize the power on this deal. I'm going to switch my diode here, and let's see what that looks like. So you can see I now have red light, and I can control the strength of this power, and imagine going into the bloodstream with this. And it is very, very, very powerful tool to be able to use. You can target this in certain joints. It's a very, very powerful tool to use. You can actually use this in different joint structures, tissue structures, and you can actually see the tissue really kind of start conforming and get that blood flow going. So that's what one of the types of photodynamic therapy here. So our IV infusion photodynamic therapy is one of the most powerful tools that we utilize for various conditions. One of the other tools that we use photodynamic therapy is patients that need to have a infrared bed bath. These are patients that are also going through some sort of autoimmune flare. We treat it for various types of conditions. Like I said, long COVID is one. We use for Epstein-Barr reactivation, Ehlers-Danlos cases, patients that may be going through chemo or radiation. What this allows you to do is increase your body's immune system to where you're really kind of getting that response that you're needing. Some patients will do this actually before they do some sort of regenerative injection as well. And so we'll bathe them in here. I am pretty happy with our results with methylene blue before they do this type of treatment, or if they're doing some sort of IV treatment with photodynamic therapy. This is another tool that we use, and we just try to make sure that it's not too much power, because these are medical grade equipment. So we actually watch you guys and make sure that you get the best results when it comes in, because your body can absorb too much energy, and you'll be able to feel it. I mean, our patients can say, man, I really feel that right now. And so unlike some of your home devices where you're actually just getting the exposure, this one is a medical grade type of procedure. So for our health professionals, medical professionals out there, the research that some of the universities and our European colleagues are doing for various type of conditions, including cancer research and stuff, is pretty outstanding. And as I'm writing my book, I'm actually putting these resources in so you can see what that looks like. For example, utilizing things like light therapy with focused ultrasound is an up-and-coming research for cancer. I think University of Michigan's doing some studies on that. University of Austin's doing some studies on that. So we're kind of following these type of research articles and utilizing some of the tools that they're doing for cancer, and just shifting focus and really kind of honing in on patients that have real bad long COVID and autoimmune dysfunction. So this bed, for example, kind of turn this thing on, you'll be able to kind of see what that looks like. Now this is at a 30% power. And if I hold my hand up underneath there, you can actually feel the heat pretty good. So this is at 30%. At 100%, it gets pretty hot. And so if you utilize, and I'll show you what some of these lamps look like. Now imagine using this type of technology and getting your body to actually just calm down. We talk about in my book about chaos, mitochondrial chaos, and the whole structure of this for my purpose on how I treat my patients is to control the chaos. If you can calm the body down a little bit and then introduce these structures, you'll see the biggest benefit. So when our team goes in and before they deliver treatments and things like that, this is one of the things that we recommend to our patients. Our patients that are going into some of the more advanced type of regenerative medicine like stem cell therapy and the more focused type of PRP therapy where we can get the high count platelets before medical providers will go in and deliver those treatments. We make sure that they utilize things like this prior to that treatment to get the maximum benefit on it. So this is another type of photodynamic therapy that we are utilizing, which is our medical grade infrared bed. Now, we were talking about photodynamic therapy, and I showed you two of the equipment that we have. Another type of equipment that we utilize is for patients that need other types of treatment, more focused type of treatment. So, for example, maybe they don't have easy vein access, or they're having some sort of issue with mold toxicity in the sinus cavity. Maybe they're having some sort of ulcer or some sort of disease in the throat itself. So, one of the things that we'll utilize here is so we've gone through a couple different types of photodynamic therapy that we utilize, and there's some other ways to do this as well. So, for example, patients that need more long term, maybe they're mobile, maybe they don't have good vein access, maybe they have some sort of sinus infection, some sort of mold toxicity that they've accrued, some sort of disease in the throat. So, one of the things we can do is we can actually utilize a mobile device that allows you to take in oral type of riboflavin, curcumin, methylene blue, and then we'll utilize this to where you can actually use this in a wrist or as an external device. One of the things we can do is to, for example, our throat patients can actually do a irradiation using this device where they put this in their mouth for a period of time. So that's a type of UV light therapy that we can utilize. Blue light therapy. Another one is a nasal cannula that we can utilize to go into the nasal aspect to get the sinus irradiated. So it'll actually kind of focus onto this area. There's some other tools that I actually can utilize to help facilitate the healing of that as well. And most patients see a difference in as little as one visit. I mean, it's not a very complicated type of treatment. It's just giving it time to heal. And at our office, we don't try to put you on a lot of supplements because we don't know what's working and what's not working. And you'll hear me talk about this in the book that I'm writing and really kind of explain why we're doing that. We just don't follow the trend of putting people on a lot of supplements and things like that, but this is what we utilize, and then we can kind of see what the outcome is. So this is just a different type of photodynamic therapy that we're utilizing here as well.